As Mary introduced me, I'm Aaron Lightstone from Music Therapy Toronto. I have many years experience as a certified music therapist and as a psychotherapist. And in 2015, I did some additional professional development specifically in neurologic music therapy, which was what we're going to really focus on today. And neurologic music therapy is a specific approach to music therapy that's grounded in neuroscience and is really good at and really sort of emphasizes the rehabilitation of brain injuries and neurodegenerative diseases. So if we define neurologic music therapy, which is an approach to the more general concept of music therapy, according to Dr. Michael Tout, who runs the Music and Health Research Center at the University of Toronto, which is an interdisciplinary research institute between the Faculty of Medicine, Music, uh, and Rehabilitation Science. According to his definition, neurologic music therapy is the therapeutic application of music to cognitive, sensory, communication, and motor function due to neurologic disease or injury of the human nervous system. Neurologic music therapy is research based, and its treatment techniques are based on the scientific knowledge in music perception and production and the effects thereof on non-musical brain and behavior functions. So it's a little bit wordy. Let's just break it down and explain what this all means. So we're looking at music, participation in music in all the various ways that human beings can participate in music, from listening to music to learning to play an instrument to dancing to music to discussing the lyrics in music, to creating music, composing music, to simply doing very simple jam sessions. If someone's got a very severe injury, they might be able just to play along on a drum. But all of these different ways of participating directly in music have the potential to impact the development and rehabilitation, depending on the situation, of sensory motor skills, communication, speech, and language skills, or cognitive skills, which, as we know, can all be impacted and impaired by either brain injury or a neurodegenerative disease. This area of research involves the scientific knowledge, not just in rehabilitation and how music can impact rehabilitation, but more basic research on how just how music affects and interacts with the human brain. And there's over 100 years of cognitive psychology research on music perception and production. It's a very old and very established area of cognitive psychology. And although we're using music, unlike music education, where we're trying to, create musicians, either professional or amateur musicians, in music therapy, we're trying to impact non-musical brain and behavior functions. And we're going to talk about that in a little more detail. I could do a whole hour-long presentation on the history of music therapy, but I'm just going to very, very briefly allude to a little bit of it. We have a very long tradition in many, many cultures of the interface between music and healing. It's something that exists and is talked about in shamanic and indigenous traditions from all over the world. And in Western culture, Pythagoras, Plato, Socrates, Aristotle, all the ancient Greek philosophers wrote and thought a lot about the healing properties of music. Fast forward to what we used to call shell shock, we now call post-traumatic stress disorder, in following the world wars, and medical people started to notice that musicians playing at the bedside of traumatized soldiers started to ameliorate and improve some of the symptoms they were having. Fast forward again to 1999, where Dr. Tout, who I mentioned before, founded the Center for Biomedical Research in Music at Colorado State University. A similar institute was founded at U of T, the Music and Health Research Collaboratory, where Dr. Tout is currently the director of that institute, and also the Tier 1 Canada Research Chair in Music, Health, and Neurology. So I mentioned that neurologic music therapy, or NMT, is a particular approach to music therapy. And the way I was originally trained in music therapy really looks at music and the phenomenon of music and health and wellness from a as a social and cultural and aesthetic phenomenon. And this is a very valuable and important way of looking at how music affects human beings. Every culture ever known has music. Music has very powerful aesthetic, cultural, and social effects, and is a very effective way at increasing group cohesion and bringing people together in very deep and meaningful ways. And that's all great. In NMT, we shift to more of a neurobiological model and approach to looking at music and how music can directly affect and improve the functioning of human brains. So there's a tremendous amount of research that's constantly ongoing and constantly growing in this. And according to Dr. Tout, what no longer requires confirmation is the premise that music in therapy works in principle and in practice, and neurologic music therapy now meets the standards of evidence-based medicine as recognized by and is recognized by the World Federation of Neurorehabilitation, and should be a standard tool for rehabilitation care. And one of the reasons for this is because we see over and over again in neurologic music therapy that when people are involved in an interdisciplinary rehabilitation team, and they've got a physical therapist and a speech and language therapist and an occupational therapist, etc., the introduction of music therapy often will increase motivation for all those other therapies and accelerate the progress in all of those other therapies. And the reason this happens is because when we think about the incredibly complex behavior that that music is, the way that music interacts with human brains, and the way that scientists never found, because it doesn't exist, the music center of the brain. There's no music center of the brain because music is optimizing and retraining brain function from multiple brain areas. When we think about what's involved in playing music or singing or learning to play a musical instrument, we can think of how, and these are just some of the brain areas that music is recruiting function from and then optimizing through practice function for. So memory gets involved, the language parts of the brain, gross and fine motor control, perception, attention, emotion, etc., etc. Music is forcing all of these different brain areas into communication with each other. And as Norman Doidge writes in his book, The Brain That Heals Itself, areas of the brain that fire together, wire together. So we're forcing all these disparate parts of the brain into communication with each other when we engage people in participatory music experiences. And this allows new neural connections to be made, potentially subverting and working around damaged or impaired areas, and thereby improving overall function. And although we're doing music and people will improve at music, like I said before, unlike music education, the goal is ultimately to improve function in non-music related areas. Part of what's interesting about this slide and why I'm showing it is just to demonstrate how, again, music perception and music production is globally distributed around the brain. In this study, this is a music perception study, not a rehabilitation study. What we're looking at here is how even with one element of music, so we've got rhythm, melody, harmony, lyrics, etc., etc. There's many elements of music, but when we look at rhythm, the rhythms in music, well, then there's different sub areas of rhythm. There's pattern, tempo, meter, duration of the notes. These are all subdomains that comprise musical rhythm. And we can see that when people are given musical perception tasks to identify and pay attention to these different rhythmic elements, we can see that even the one element of rhythm and perceiving rhythm is globally distributed around many different parts of the human brain. What So that's one thing that's unique about music, and one of the reasons why there's so much therapeutic potential in music. Like we said before, music is universal, and it's unique. So it's universal in the sense that every culture ever known, ever studied, has some form of music. And now in the modern age, most cultures, if not every culture, has many kinds of music. And music has this ability to stimulate and activate and force into communication many parts, if not every part of the human brain. We could argue that other activities like martial arts, athletics, meditation, and yoga may have similar effects on stimulating neuroplastic processes and being very useful in rehabilitation. But what's different about music is that music is highly adaptable to every single stage of the human lifespan and every degree of ability or disability. So, for example, we have music therapists working with neonates in neonatal intensive care units, and there is a lot of really interesting evidence to show how the effect of music in that neonatal intensive care environment has a direct positive impact on the physiological measures of infants that are in intensive care. In an earlier part of my career, I've never worked in neonatal intensive care, but I've worked in hospice care. So I've provided calming live music at the bedside in hospice and palliative care environments as people are taking their very last breaths, and that is can be very meaningful. We assume to the patient, but we get the feedback that we get from family members in those situations is that it's a very useful intervention, at least for the family members, and we assume also for the dying person. So we see that music exists across the entire lifespan, and we can adapt our music interventions to pretty much any degree of ability or disability. We have music therapy interventions for people with mild cognitive impairments following a brain injury, and we have music therapy interventions for people who are very severely injured and are in a minimally conscious, i.e., resembling comatose state. So, that's what makes it different from other activities that are very effective at triggering neuroplasticity and helping to heal the brain. Um, this slide is just to emphasize that we have the research that supports neurologic music therapy exists in studies of rehabilitation, but also more basic science that just studies the effect of music on the human brain, where we can see that after training in music, or there are measurable differences in the physical structures of the human brain. One that's interesting is if we look at the arcuate fasciculus, which is the connective tissue between Broca's area and Wernicke's area. So these are the parts of the brain that are responsible for the production of speech and the understanding of speech. There's a connective tissue that connects them, of course, and that tissue is measurably thicker and denser in people with music training compared to people without music training. And it's measurably thicker and bigger, again, when you compare professional singers to professional instrumentalists. Just one example. If we look at the applied science of the neuroscience of applied neuroscience of music, where we're looking at specifically at how it operates in the rehabilitation context, then this is just one example of many papers that have been published in this area, and where we see that there's a potential for music therapy interventions to improve the executive functioning of individuals and the emotional adjustment after a brain injury. particularly as it relates to motivation to participate in the full rehabilitation program. This is a very important fact. In neurologic music therapy, we look at three broad domains of human functioning and rehabilitation. So we're looking at primarily sensory motor skills, and or, depending on the needs and injury of the individual person, speech, language, and communication skills, and cognitive skills, which includes things like executive functioning, memory, auditory processing, mood regulation, and response to traumatic experiences. So these are the three big areas that we're looking at helping people improve their functioning with. And then in order to do that in neurologic music therapy, we have 20 standardized techniques that we use to achieve those therapeutic and rehabilitation goals, depending on what we're working on. And when I say standardized, I mean standardized in terms of that we have a sort of a protocol and a language that's standardized to describe and put a framework around what we're doing, but there's still a tremendous amount of need for the creativity of the music therapist to figure out what music and how is the and what music and exactly how to adapt those techniques to the individual person that we're working with. There's no way in a short presentation like this that I can get through all 20 techniques, and I'm not going to try to describe all 20 techniques. I'm just going to pick a couple. So when it comes to sensory motor skills, rhythmic auditory stimulation, or RAS, is the one that probably has the most research around it. So I'm going to I'll briefly speak about that, and I'll also mention therapeutic instrument music performance as a very concrete example of what we're talking about here. So RAS is a technique that's used to capitalize on the fact that a lot of the rhythmic information in music, but like that slide showed us, not all, but a lot of the rhythmic information in music is processed by the primary motor cortex, the same part of the brain that is responsible for controlling gross motor movements like gait, like our ability to walk. And after a stroke or after a traumatic brain injury, if somebody's ability to walk has been impaired and they're doing physiotherapy to relearn how to walk, the application of a simple rhythmic auditory stimulus to their environment when they're doing that can have a very dramatic effect on the rate that they recover their ability to walk, because we're providing that auditory stimulus to the motor cortex. And I'm going to show an example of that in a moment. Before I move on, therapeutic instrument performance. This is taking any way of using the playing of a musical instrument to accelerate, achieve a therapeutic or rehabilitative goal. So maybe somebody's got an injury that means that their range of motion has been impacted, or their grip strength has been, or even their ability to grip something has been impacted. So then we might engage this person in something that resembles a jam session where we're playing music that they like live in their environment. We've given them a simple percussion instrument to play along with, but maybe we've adapted the stick with a foam grip, and we over time make the grip smaller and smaller so that it goes back to a stick, so that we're working on grip. Or we're putting the instrument just at the edge of their range of motion, forcing them to reach and extend, and we can then pull the boundaries of that, and it starts to become a form of physiotherapy, but it's happening within the context of a fun musical activity. Okay, so back to rhythmic auditory stimulation. I'm going to show this video. It's a short and dramatic example of what we're talking about here and how this works. This is from my colleagues at Spalding Rehab in Boston, a well-known rehabilitation center. So our client here has had a stroke, and he's relearning how to walk. He's, you can see here that he's got a very not very rhythmic gait, and he's using a four-pronged cane as an assistive device. And he's got a physiotherapist or a physiotherapy assistant helping him. So then we start RAS, or the therapist started RAS, which is introducing a very simple but strong rhythmic stimulus into his environment. So this guy's just strumming a guitar. As the session goes on, gradually speed up the tempo, and we can see what happens to his gait. This is all in the context of one single session. And then we remove the music because we want to see the effect of the music on non-musical behaviors and activities. That's a single session, and we're always in neurologic music therapy interested in what are the metrics that we can use to measure progress. So we can see that the tempo has increased from 65 to 120 BPM and with cane to without cane, and the distance that he's able to walk is dramatically increased. That's after one session. That's at the end of one session. Typically, though, it will require many repetitions of that for that to have a longer carryover effect. All right. If we look at the way that we use neurologic music therapy in cognitive rehabilitation, there's many sub areas of cognition. Cognition, obviously, is a very big area and a big part of what makes us human. So we've got sensory orientation. This is a technique that we use where we're using live music right up close in a person's environment to reorient their senses. This is typically what we're using with people who have a very low level of awareness and a very low level of ability to interact with their environment following a very severe brain injury. And we're simply using music to awaken the senses and orient the person to the here and now. And this is a technique that we use with minimally conscious people, with people that have very profound brain injuries. And what we often see over time is that the introduction of rich sensory stimulation, like live music, into that environment, right in their face, according to their musical preferences, often results in a bit of an awakening. Oops, I don't know why my thing keeps jumping around. And we have of the 20 standardized techniques that I mentioned before, we're able to work on sensory orientation. Auditory perception, of course, is a big thing in music. Hemispheric neglect is very interesting in NMT. This is the effect typically often after a stroke, where someone is unable to perceive visual information on, I'm blanking out if it's the right or the left side, but one side. They've got hemispheric neglect, and by introducing music instruments and music activities on the neglected side, the auditory stimulation can help sort of reconnect the visual stimulation piece of it, and so on. I can't speak about all of them. And then psychosocial training and counseling is an area that I'm particularly interested in as a psychotherapist, and this is where we're using music to help people with all kinds of issues related to insight and mood and recovering from potential response to trauma and post-traumatic stress kind of situations. I've already addressed this slide. Oh, but I'll add one point. When we're talking about backing up to musical sensory orientation training, and this idea of using live music right up close in a person's environment to awaken and stimulate their senses, and then we're just simply stimulating them, and then when we get a response, then we're trying to orient them to the environment and the here and now. And then if we're getting that, we can push them into vigilance and attention maintenance. And we often do this with getting them to play simple instruments in the context of the music that the music therapist is providing in that moment. And at Temple University, I have a colleague, Professor Wendy McGee, who's developed a tool called the MataDoc, Music Therapy Assessment for Disorders of Consciousness, which has been demonstrated to drastically improve the accuracy of differential diagnosis between a vegetative state and a minimally conscious state. So these are people that are, very, very severely injured and might be in what looks like a long-term coma kind of state. And there's very important prognostic and legal implications to be able to differentiate are those folks in a vegetative state or a minimally conscious state. And this assessment tool that she's developed that involves music therapy has been shown to drastically increase the accuracy of that differential diagnosis, which is very important. So here's an example of musical sensory orientation training in action. So we're working here with a person who's got who's very impaired as a result of a brain injury. Not really alert or awake, and just trying to get her to hear the music and to play along. And there's not much response until there is. I'm just gonna jump forward here a little bit. And you can see here we start to get some alertness, and although it's very minimal, we start to get some independent movement with the drum brush on the drum, making a little bit of sound. And I'm gonna jump ahead here to. Gonna jump ahead. Wait. Okay, here we go. So we've got a virtual keyboard instrument on the iPad. And now that we've moved from sensory orientation into that vigilance and maintenance stage, we're now just trying to get interaction, musical interaction, and independent movement. And there's feedback because the person's now having a direct impact on her acoustic environment. And at this point, we're looking for more for quantity of response and interaction rather than quality of response. We're just trying to get
Got an itch? Need to scratch?
Get independent movement, independent impact on the. Oops, sorry about that. Anyway, we can move on from that. When we look at some of these other cognitive techniques, the reason I've got this slide here is because sometimes when people have had a brain injury, or always when people have had a brain injury, occupational therapists are very interested in what is the new learning that a person can engage in to activate and stimulate multiple parts of the brain. And I often engage people in beginner guitar or beginner piano lessons in order to achieve some of those goals. And this can have an impact on attention. So musical attention and control training, MACT. We can work on executive functioning with this. We can work on psychological, sort of psychosocial, psychotherapeutic goals, and of course, auditory processing. So attention, executive function, psychosocial, and auditory can all be achieved through modified beginner music education programs. Of course, also sometimes, although we said that we're primarily interested in the impact of music on non-musical functioning and behaviors. Sometimes though, I get referrals where someone has been a musician before their brain injury, and um, the reestablishment or the relearning of music skills for the sake of music skills is a very important therapeutic goal. So, and in those situations, we're looking at the impact of music on music skills, because those are very important parts of the person's identity and their ability to function. This case here is interesting because I don't usually teach people how to read standard music notation, because it's a very, very abstract, symbolic language, and for many people with a brain injury, it's an unnecessary layer of complication. But this slide is here just because this particular individual that I took this from wanted to learn how to play the guitar, and it was very, very important to him to learn how to read music at even a basic level. And the fact that he was able to succeed at that was a very, very important measure of rehabilitative and therapeutic progress. Okay, so I think we have an example here. C, yeah, and G. Good. So in an adapted music lesson for somebody with a complex brain injury, there's elements of it that to a fly on the wall would look a lot like a regular music lesson. But of course, as a music therapist, we're constantly adapting all kinds of music education protocols to the needs and interests and rehabilitation goals of the individual person. So with this person, you can see that although we're working on attention and executive functioning, there's also at the same time a very important auditory processing and motor skill component. You can see the rigidness, particularly in his strumming hand, which is something that we're constantly working on. And you can see how this kind of activity is bringing together memory for how do you form the guitar chords, visual processing, because he's playing chords according to the lyrics on the page that I'm pointing out, auditory perception, because he has to hear the lyrics that I'm singing, and he has to track on the page and then move the guitar chords accordingly. So you can see it's a very, very complex skill that can work on many, many different aspects of rehabilitation at the same time. Find myself in times of trouble, Mother Mary comes to me, speaking words of wisdom, let it be. Good. So let's do that exercise again of just put the G chord on. Put the G chord on. I'm gonna just skip ahead. I'm just gonna give a few little sort of vignettes here about how I've used these adapted, modified music education interventions to achieve various rehabilitation and therapeutic goals for different people. So the first example is I don't know why it keeps doing that. Okay, is somebody who had a brain injury in a motor vehicle accident, and had some mild cognitive impairments, but the big issue was emotional regulation. Person became very, very dysregulated as a result of the accident, and was suggested by the occupational therapist that I get involved and provide beginner guitar lessons so that the person could have a new leisure skill, something to focus on and achieve while he was off work on a health injury leave, and also that we could maybe just do some psychotherapy around the emotional regulation. But what surprised me and what I didn't expect with this person was when I started teaching him how to play the guitar, and I gave him the most rudimentary guitar exercises that are used not because they sound like music, just to start to get the fine motor skills happening. So it's this exercise where you go like, this guitar's not plugged in, but just very, very rudimentary exercise, which is not easy at the very beginning. A lot of beginners struggle to get the right technique for this exercise. At the beginning, it's a little bit challenging. And what this individual reported was that just by engaging in that exercise when he was home alone, there was something about it that really just calmed him right down. And he quickly learned that if he was feeling emotionally dysregulated, instead of trashing his apartment, he could pick up his guitar and do these very, very basic, very rudimentary exercises. This other individual was somebody who was a skilled amateur musician on multiple instruments before his brain injury, and was reported that this person had pretty significant depression and anhedonia, the inability to experience pleasure from anything, was physically uncomfortable holding and playing his instruments, and felt that he just did not have any of the cognitive stamina or attention to be able to play music anymore, and wanted help re-engaging in music. And this was a particularly successful case because when I first started working with him, again, I brought him that same page as the other gentleman had, where the lyrics and the chords for Let It Be, which is a pretty relatively basic song for a guitar player to just strum the chords to. And although this person had previously been a skilled amateur musician, he couldn't do it. And so I had to retrain him. I had to do some problem solving around how to get him to be more comfortable physically holding his instruments, because there was a lot of pain involved. And slowly we got him playing again, and we got him enjoying music again. And one of the things that really worked well for this particular individual, who also had a background in engineering, was we got him a very, very sophisticated keyboard instrument, the kind that is a one person band, where you can hit one note and trigger a whole complex accompaniment in many different musical styles. um, and when we got him that device, after a certain amount of work at getting him back into music, it it sort of tweaked that engineer interest in him that was still there. And like I said before, from that study that showed that the introduction of music therapy often improves people's motivation for their overall rehabilitation program, the introduction of that keyboard instrument was something about the novelty and the music that he could create with it that really motivated him, despite his cognitive impairments, to go and figure out strategies to figure out how to use this complex instrument. And he had to figure out, like, how am I going to remember that this button is this function that I want? And he came up with systems to help him keep track of that kind of thing, and to engage with both me as a musician and this complex musical device. So we kind of broke through that anhedonia and that inability to complete the executive function of initiating tasks. Because between sessions, he was very motivated and very involved in learning how to use this instrument. And then the real measure of progress came when in summertime rolled around, and this person who had been previously just not interested in leaving his house at all because of his depression and anhedonia started looking up on the internet what are the free concerts and outdoor music festivals happening around town, and starting to get making arrangements for his wife to take him to these events. So that was incredible progress. Anyway, I could go on and on, and I want to make sure we have time for questions, so I'm going to just go to the next slides, and mention and highlight that we were just all talking about sensory motor skills and cognitive skills. We have a wide range of techniques to address impairments in speech, language, and communication skills with neurologic music therapy. One of the most researched ones is melodic intonation therapy, MIT. This is a technique that we use when a person has become aphasic, usually as a result of a stroke, and they're not otherwise cognitively impaired. So their cognition and their understanding is intact. They've lost their ability to speak as a result of the injury, and they're frustrated by their inability to speak. And in melodic intonation therapy, which is a technique that goes back to the 1970s and is also known to speech language pathologists, we isolate very small fragments of speech, like my name is Aaron, or I am hungry, and we create very short melodies for those fragments of speech, and we teach those tunes and those words to the individual, and we add a rhythmic stimulus, because remember, rhythm stimulates the motor cortex, and the motor cortex is involved in operating the whole oral motor respiratory system. So there's this pumping of the hand or tapping on the person's knee. So in this video example that I'm going to show, again, colleagues at Spalding Rehab doing MIT with a person who's experienced a stroke, lost their ability to speak. You're going to see also the technique of therapeutic singing in this video, which is typically can be a very familiar song. And therapeutic singing is a very sort of a little bit vague in its definition, and it's any use of singing to facilitate therapeutic goals. But what we see when we sort of warm up the person in the situation with therapeutic singing before we try to do anything related to speech, language, and communication, because singing, unlike speech, involves the entire brain, the entire nervous system, essentially, it's kind of like lubricating the engine. It gets things working more effectively, more efficiently. So let's just take a look at what Brian at Spalding is up to. So this individual's had a stroke, as I said, unable to speak.
Try it again.
So it starts to warm things up with the therapeutic singing. Just take a very familiar song and get the person to sing as best they can. No words.
I'm Peter.
Okay, notice the
I'm Peter.
pumping rhythm.
I'm Peter. How are you? How are you?
A lot of repetition. A lot of repetition. Don't know how many sessions, but check this out.
Hello, I'm Peter. How are you? I am good. Thank you. How are you? You are my sunshine, my only sunshine. You make me happy when skies are gray.
I mentioned how the connective tissue between Broca's area and Wernicke's area responds to musical training. There's some very interesting studies that show that it becomes more robust in instrumental musicians versus people without musical training, and then more robust when comparing singers to instrumental musicians. I'm gonna skip. Oh, here I am. Maybe I'll show this. Actually, hold on. Let's go.
Let's try.
Okay. Lastly, going back to the cognitive rehabilitation side. This is a very interesting journal in the scientific literature, Music and Medicine, interdisciplinary journal. This image from 2018 was a special issue that was guest edited by Stephen Porges, who is a neuroscientist, who is one of the leading thinkers in the field of trauma recovery, particularly the polyvagal theory of trauma and trauma recovery, which I don't have time to get into right now, but it's the idea that the 10th cranial nerve, the vagus nerve, is responsible for all kinds of psychosocial and physiological functions. It's the connection between the brain and the internal organs and the facial muscles, etc. And in traumatic experiences, its functioning becomes less than optimal. That's the very, very summary version of the theory. It's much more complicated than that. But anyway, just to say, he was a guest editor of the journal when they did a special issue on music therapy, and trauma recovery. And in the domain of psychosocial functioning and music therapy interventions for psychosocial functioning, I want to just highlight a study that I was involved with, that I published. It was a retrospective case study where I was working with a veteran of the Canadian Peacekeeping Service who had a very, very complex history of very severe post-traumatic stress symptoms. And the short version of the story is that working together with him and his psychotherapist of 8 years, what we were able to do by engaging him in what we call improvisational music therapy, or clinical improvisation. This is where the client is given instruments that you can make complex sound with, but you don't need to be a musician to be able to do so. So things like xylophones and drums and all kinds of percussion instruments. And the client starts to improvise and emote and express on those instruments. And the job of the music therapist is to really, listen very carefully to what they're doing and accompany them, improvise an accompaniment that takes their expression and puts it into a musical context and container. This was a very interesting case that I can do a whole hour-long presentation on this one case. But what we found that was by doing these improvisations with this particular client, he was able to really start to, by doing these improvisations and having often intense emotional responses to that music, and then verbally debriefing and discussing those experiences, this person was able to gain a lot of insight into his condition. He was able to, in a very productive way, increase his emotional vocabulary. This person had a lot of very strong negative emotions like grief and rage and anger and sadness, but any intense emotion he would simply label as rage, and he said that he was incapable of any other emotional experience. But what we found that was when we tried to challenge him by saying, no, here's a xylophone, and what if you're playing sad music? It's like imagine it's a movie scene, and I just want you to play sad accompaniment music for the scene in the movie. He at first was not able to do it. He'd play for seconds and then throw the drumsticks down on the floor and say, I can't do it. So progress was measured in the fact that we increased that response to from almost no time to 10 seconds to 90 seconds to 2 minutes, etc. And got him to be able to tolerate all the physical sensations that accompany emotions, and get him to recognize that he was capable of a more complex range of emotional experiences than just rage. And in self-reporting surveys and so on, determined that he also was experiencing a very significant reduction in some very important measures of post-traumatic stress symptomology. And that study has been that was published as a retrospective case study in the Journal of Arts and Health back in 2015. So we're running out of time, so I think I'm going to maybe just leave it there with and I'll just mention that music therapy, particularly neurologic music therapy, is always almost always takes place within the context of an interdisciplinary care team, and that we often see an improvement across many different brain areas. And to summarize, like what I said before, music is it's doing this because it's recruiting and optimizing functional brain performance from many different brain areas and forcing different brain areas into communication at the same time. So, according to Zatori, one of the prominent researchers in the field, making music is one of the most complex and demanding neurologic tasks for the human brain. And while musical expertise is a learned skill, almost every human being has a sophisticated network of neural systems that allow them to meaningfully perceive music, even those with significant neural disease damage or delay. And this is the phenomenon that we are harnessing and taking advantage of in the clinical setting with music therapy.